We don't care what's true. We just want controversy, So anyway. But if you look at all the literature, a meat-based diet is not very helpful when compared to a plant-based diet. Plant-based diet is another way of saying vegetarian, but it doesn't push people's buttons quite the same way. Cholesterol is only found in animal products, which also tend to be high in both total fat and saturated fat, which your body converts to cholesterol. Whereas there's no cholesterol in plant foods, none at all. And with few exceptions, tend to be low in both total fat and saturated fat. Meat is high in iron, which oxidizes cholesterol to a form that makes it more dangerous. It's more likely to be taken into your arterial wall. That's very low in a plant-based diet. In fact, one of the reasons why premenopausal women may have less heart disease than men is because when they menstruate every month, they lose the iron in the blood. And so the iron, you shouldn't even be taking iron in vitamins unless you have a real iron deficiency anemia. Whereas instead of being low in oxidants, a plant-based diet is high in the antioxidants, beta-carotene, vitamin A, vitamin C, vitamin E, that help to prevent that. They also help to prevent the formation of what are called free radicals, which are not Jane Fonda in her earlier days, but have to do with substances that can promote aging and cause cancer. And the final thing is that there's no fiber in meat, which is high in a plant-based diet. If you look at other parts of the world, you find in China, for example, can you see these slides? Is the light too bright? Or is that better? Yeah. That in China, they have a fraction of the... I'll just leave it like that. It's fine. In China, they have a fraction of the heart disease that you find in this country. It's not even close. I don't have a pointer here. I'll just use the old-fashioned pointer, this one. You can see here, and yet when those same Chinese moved from China to the U.S., oh, thank you so much. I feel like a professor. Or a drill team leader, I'm not sure which. When the Chinese move from China to the U.S., they go from this to this. They go from one of the lowest to one of the highest rates of heart disease in the world. And so it's not a genetic difference, it's a lifestyle difference. What's discouraging is that in many countries, like Japan, where I was lecturing about 2 years ago, in Japan, the average cholesterol in boys aged 10 to 12 in Japan is now not only as high, it's 75% higher than American boys aged 10 to 12. What that means is in one generation, they're going to go from this to this. And it's so preventable. It's so much easier to prevent disease than to try to reverse it. And it's not just heart disease. Colon cancer is a fraction of what you find in this country. So is prostate cancer in men, and lung and ovarian cancers, breast cancer in women, osteoporosis, diabetes, hypertension, obesity. A wide range of what are called degenerative diseases are directly linked to the intake of animal products, especially red meat. If you look at vegetarians in this country, Seventh-day Adventists have 3 times less fatal coronary heart disease than non-vegetarians. Many years ago, Dr. Frank Sachs, who's at Harvard now, and I we actually drew blood at the ashram in Connecticut, at the Satchidananda ashram in Connecticut, and we looked at all the cholesterol levels. We found they were much lower than people in the general public of the same age. So the diet that I think is optimal, certainly for reversing heart disease, is much lower in fat than most people eat. It's about 10% fat. The average American eats about 40% fat. The American Heart Association recommends 30% fat. Now the problem, a 30% fat diet means less red meat, more fish and chicken, take the skin off the chicken, 4 eggs a week, and so on. The problem with a 30% fat diet, it doesn't work. It just doesn't work. Studies have shown your cholesterol level comes down by only about 5%. In fact, one study came out a year ago, and they said, why even bother? Just put everyone on drugs. Diet doesn't work. In our study, cholesterol levels came down by 40% on average. Many people came down even more than that. It also means if you lose weight, you gain it back. It means, worst of all, if you have heart disease, that your heart disease gets worse over time. And in every study that's come out, and there are over a dozen, if you have heart disease and you only go on the